As a broker for 35 years, as I'm looking at your plan, you're 40 to 60% less in premiums than traditional plans like this. And I'm just curious, internally inside of your own system, how do you make that happen? Can you tell us more about that?
You know, it's less about what we do and more about how we think about it first, though what we do is important also. But with most of the traditional options, people are thinking about just how they can spend less in healthcare. We don't think about it that way. We want to figure out what's the right spend and how do we get that right spend, and it always starts with what's the right care. So if we know the right care and we always get the right care for people, the cost automatically goes down in half approximately. And let me give you an example of that, because I know that can sound a little unbelievable. The system right now charges generally, $3,000 to $4,000, $5,000 for an MRI, especially if you're in a hospital system. We both know the fair price is closer to $3,000 to $4,000, maybe $500 in some markets. So the charge price is $5,000, the fair price is under $500. But what's the right price? Well, it depends. Do you need the MRI or do you not? The right price for an MRI you don't need is always zero. The right price for an MRI that you don't need when you really need a $25 x-ray is zero for the MRI, $25 for the x-ray. You apply that thinking over and over and over and over again, and what you find is just a lot of the spend just doesn't happen. It goes to zero. And it really doesn't matter what things cost if you can apply the zero charge where it's appropriate. It's just basically the stuff that every mom with a medical degree does already for her own family. As a matter of fact, every insider, every CEO, everybody who's next door neighbor is a doctor already applies that watchful waiting. Let's just do a little bit today, and tomorrow morning we'll see what's next. But when you walk into a doctor's office, you turn that doorknob and you show that insurance card, no, that's not what's happening. We have to do everything we can on that day, then you're there. There's no watchful waiting, because otherwise we might be dealing, next time we see you might be in a courtroom 4 years later. And we want to make sure we did everything we could, we thought out every scenario, and that quite often can lead to tens of thousands of dollars of charges that could be zero.